How can EMDR help you to heal your childhood trauma? You are perhaps there seeking information about the childhood trauma you've experienced. Perhaps you've experienced the mother wound, father wound, maybe you had an absent mother, absent father, maybe there's been abuse in your childhood or any other negative, really difficult life experiences. And perhaps you're left with anxiety and depression and you are seeking for information on how to get better. What would help you to heal? Hi, my name is Dr Mari Kovanen. I'm a counseling psychologist in the UK. I work with men and women who experience anxiety, depression, and have relationship difficulties. And in the heart of my work is really trauma work, and especially when we are talking about attachment trauma. And by attachment, I mean the bond that you had with your primary caregivers. So any kind of childhood trauma. So today I really want to bring some hope for you that there is a way to heal that pain that you're experiencing, that the childhood trauma has left. And I've been practicing for the past 15 years or so. And one of the tools that I use in my therapy practice is something called EMDR. So you may or may not have heard about it before. EMDR stands for Eye Movement Desensitization and Reprocessing. And what it is really, it is a treatment protocol. It is a treatment method that I personally use as a part of normal talking therapy. But it is a tool that allows us to go and reprocess old, unhealed, unprocessed, difficult life situations. So basically what's happened is that when you experience adverse life event, whether these were what's called big T trauma, so those would be any kind of abuse, road traffic accidents, and what's kind of traditionally thought as trauma. And then we've got this small T trauma, which is childhood emotional neglect. It is having a critical parent, having a very distant parent, or it could be bullying, for example. It could be any other adverse life events that as a single event, it perhaps would not be so significant, but because there has been many of them and there has been a compounding effect of these adverse life events, they have left these wounds within you. And your body remembers every experience you've ever had if it hasn't been worked through and processed appropriately at the time. How EMDR process starts is that, like with any therapy, we start with taking your history and understanding how you got where you are today and what are the current difficulties that you are experiencing. We also give you tools for helping to soothe your difficult emotions and helping you to regulate your emotions, because this is often something that my clients never learned in their childhood as a result of the difficulties in those early relationships. And so we give you some tools for grounding and soothing yourself, and help you also to understand and make sense why you're behaving in a particular way. Because basically everything's about survival. Our body and brain was designed for surviving. Our humans as species wouldn't have survived without these tools. But we are still in today, we are reacting in the same way as that early man and a woman who lived in caves. When those adverse life events are stored in your body, they get activated in the here and now. For example, if as a child you had a critical parent, you have installed this in your body. So maybe then you have a boss, even your partner or someone who criticizes you for something. And what happens is that old experiences get activated in the here and now. And then you may, for example, struggle to kind of communicate and about your boundaries and that you don't appreciate that kind of behavior. So you may even shut down, and you may feel exactly like being like when you were that child. What EMDR allows us to do, and this happens during our REM sleep. During our REM sleep, our brain is sorting out all the information about what happened yesterday and how does that integrate with all the other things that we've learned and experienced and so on. So we are creating the same conditions. I'm oversimplifying a really complex process, but essentially this is what happens, is that we are almost like updating your computer. You know, your computer, you need to update the programming sometimes because, you know, there's a new version or whatever the next one is. And this allows the computer to work better. So in the same way, we are creating the conditions where you are completing a very simple task. For example, it started with tracking eye movement, tracking. This could be done in other ways too, which keeps your focus in the here and now. And then at the same time, we are visiting and thinking about the old situation and everything that was going on, what you felt in your body, what kind of thoughts, images you have, and so on. And when we are pairing these two, there's a crossover between left and right hemisphere. And this allows us to create new neural pathways. And it is the new information, the present day safety, that allows, we are kind of visiting the old memory, but it's overriding that old knowledge and integrating that old knowledge and into the new information. Trauma creates disconnection, and EMDR allows us to create that connection for those parts of your present day and your past self to connect together. And then we are processing the old feelings. Feelings tend to have this, they're like waves, they come and then many people try to block it or try to avoid or do something with the feeling because they feel that it will never go away. But in fact, if you allow the feeling to go up and then subside, it subsides and it gets better. And when we are visiting an old memory, we are visiting also the old feelings, and we are reprocessing them. And when we are able to do this process, then that old memory becomes part of your path to today, and it doesn't get activated anymore. Even if you are in a situation where potentially in the past it got activated, and then what that allows you to do is to then react from the present day self. So how you are as an adult. And many people find it very useful, and many people have found it very useful and helpful. How long does it take? Well, how long is a piece of string? It all depends on if you've had any previous therapy experience, how you're able to tolerate difficult feelings, even if we give you some tools to really regulate yourself, and how much effort you put into your healing process. So there are so many things. I believe very much that the therapy works on kind of 4 levels. So there's, of course, the deep work that, for example, the EMDR we do. Then there's the therapeutic relationship, which is really important, that you feel comfortable working with your therapist. Then it's about doing the reparenting piece, which is about giving yourself what you needed as a child, and perhaps teaching yourself these skills of soothing yourself. And then the 4th piece is also then it is the interaction with your environment and kind of testing out this new knowledge. So if you are now wondering about EMDR and whether it could help you, I offer a free consultation where you can come and talk about your situation, and we can figure out whether we would be a good fit to work together. And you can find the details on my website, and you can book this call there. And I look forward to speaking with you soon.